Have you ever felt short of breath, a tightness in your chest, dizziness, palpitations, or had a pounding heart? What do these symptoms remind you of? Well, this online peer says it sounds a little bit like heart failure. But this online peer from Australia thinks it sounds like it would be a bit more gastric problems. And Google has diagnosed you with symptoms of anxiety. So now we're left more confused and with even more questions than we have answers. Many heart failure symptoms sound similar to those of other conditions, and it can often get misdiagnosed online. For example, the internet doesn't consider your past medical history, and it usually provides you with a more generalized diagnosis as opposed to an individualized one. How have 80% of internet users now become patients to Dr. Google? And what type of information are these people seeking when they go online? Well, with technology constantly advancing and over 1 billion health searches being made on Google every single day, it's extremely relevant for us as healthcare professionals to know and have a better understanding of what type of information people are seeking from online and the patient's use of it, so we can promote a safer practice for our patients. And this is what my research explores. I began with doing a mixed method systematic review, which then led me to do an exploratory study of heart failure online health forums. I analysed 10 of these online health forums, and this was to find out what type of information people were seeking, and then I analysed the responses they were getting to know the kind of advice that was being provided on them. One of the main findings that we found was the type of information that was being sought was support. And by this, I mean people were getting the diagnosis, but they wanted to know the supportive aspects around that diagnosis. They obviously weren't getting it from the healthcare system enough, which drew them to online. One example that kept reoccurring in our findings was that people would go to their healthcare professional appointment of 10 minutes. In those 10 minutes, they would get diagnosed with heart failure. They'd then get an information leaflet about their new diagnosis. They would get put on a whole range of new medications that they'd never had before. And then they would get told you've got a follow-up appointment in 1 month. But there was next to no or very minimal therapeutic support. And what happens between their new diagnosis and the follow-up appointment? Well, this is what my PhD aims to address. We hope that we can provide a supportive platform with our findings. And we hope that this platform will connect with all of these people that are going through similar experiences, but in a safe way. And they can communicate with each other. We hope that this platform can be something that healthcare professionals can recommend to their patients, so they're not just covering diagnostic aspects, but also therapeutic, and so that nobody has to go through any of their conditions and symptoms alone. Thank you.